name is Lorraine. I'm a licensed clinical medical social worker currently employed at Ancora Home Health and Hospice. I would like you to join me today as I describe to you a typical workday, driving in my personal car about 60 miles a day throughout the Mat-Su Valley, visiting elders in their homes, residential facilities, and occasionally in the hospital. Although this may sound sad to you, I really enjoy the career field that I've selected and the path that's kind of taken me in the last 19 years. And the oldest person I'm currently working with right now is 102. So my day starts at 8 in the morning at my desk. I'm catching up on phone calls, checking emails, just kind of crisis management stuff, whatever's kind of left over from the day before, prioritizing my day. Other stuff like paperwork for advance directives, power of attorney paperwork, Meals on Wheels, sometimes food resources, whatever it takes. Next, around 8:30 in the morning, our staff get together and we do literally a stand-up in a circle with the nursing staff, the chaplain, myself, and a supervisor, catching up from on-call phone calls from the night before, and just trying to prioritize the day, including admissions, whatever may have come up in the last 24 hours. Again, I return to my desk around 9, and I start making phone calls, setting up my schedule for that day, because every day is a different day, not knowing what's going to happen. Sometimes I make a bereavement phone call if there was a death, and just trying to catch up from whatever may come up. Sometimes, I have to go and pick up durable medical equipment or incontinence supplies, so maybe stopping at Turn a Leaf and just seeing what other equipment people need. Again, Meals on Wheels, helping people connect them to resources in the community. Also, just dropping off paperwork, picking up paperwork, and coordinating care throughout lots of different agencies all over the Mat-Su. We service from Sutton all the way up to Willow. The first family I would like to describe to you was actually already known to me. 4 years ago, I had been there for an admission with the father who had a terminal illness. And this time, most recently, I went to support the family with the mom who was terminally ill. It was a warm, welcome home, 4 generations of family surrounding the hospital bed in the living room. Just sharing life review stories, talking about past accomplishments, and just the family was really wonderful. In the background, there was a 2-year-old playing on the floor, and we just talked about, making end-of-life plans, like a funeral, and what that would look like with support from the church. So I left that home feeling really good for what I could do with them and supporting them in that journey. In contrast, the next family I went to visit was 24 miles away, more rural, less support in that home. It was a daughter who was trying to take care of her elderly father who experienced dementia, and she was the only caregiver. She was really isolated. So myself and a nurse went to that admission together, explained the hospice philosophy, and just kind of did what we could to support her. It was obvious when I went into the home, things were a little off. There was unpacked boxes, a broken window in the back of the home, and she was really having a hard time trying to raise her own child, take care of a parent. There was strained relationships with siblings, one of whom had been incarcerated. So she was really having a really hard time, besides accepting that her dad was declining. And at one point, when we were trying to discuss funeral plans or what was going to happen next, she pretty abruptly got up, left the room, slammed a door, kind of had a meltdown, and it took some gentle prompts to get her to come around and process and talk about it and work through that. It was really hard for her. So I left there knowing that I had supported her the best that I could and trying to get through a really difficult situation for that whole family. My ability to take a lunch break varies day by day. This is a view of Lake Lucille and Wasilla, one of my favorite spots to stop. Sometimes I take a lunch, sometimes I stop and get a lunch. Kind of depends if it's cold in the winter or hot in the summer. But it's nice to get out, just walk, take a break from it, and regroup, catch up again on phone calls, emails, and any crisis management stuff that comes up throughout the day, and support my coworkers. The next family I visited was an elderly lady who lives in senior housing. She actually lives alone with support from a daughter, but there were some self-neglect issues and an open APS, or Adult Protective Services, situation going on. I was kind of problem solving with her. She was actually a home health patient, on coming up with a safe 24-hour care plan so that she felt like she was more supported. I helped her make some phone calls. She had some difficulty using a smartphone because of vision loss and hearing loss. So I just sat there at the edge of the bed and assisted with trying to come up with agencies that could come in and do extra PCA hours or personal care attendant hours, and support her when the daughter was leaving on a vacation for 2 weeks. And as I was sitting there on the edge of the hospital bed, I was playing with the kitty and just making her laugh, and it went really well. It was a good visit, and I felt good when I left there that I had helped her out in a difficult situation. The next person I visited is actually living in an assisted living facility, like a nursing home. Again, there was an open Adult Protective Services case with this family as well, a history of some financial exploitation issues, and the patient was alert and with it enough, she was able to revoke that power of attorney. So again, I just spent time with her going through some of those strained relationships and questioning, how can this happen to me at this point in my life when I need the most support? The people I thought I could trust were not able to do so. So I just did life review, sharing life review stories and talking about past accomplishments and how she had overcome adversity before and what that looks like now. So again, I felt really good supporting her in that, and just talking about a really uncomfortable, difficult situation and those grief and loss over things that you can't control at that point when you're really vulnerable. I end my day around 4:30, finishing electronic documentation. There's a lot of notes I have to do in charting, communication with nurses and doctors, other family members, sometimes a supervisor, sometimes making a report to Adult Protective Services, and sometimes I'll get to go back to the office, but many times I finish my day in my car and just go home. So every day is a different day for that. And my education at UA really helped me to learn the resources in the community, learn comprehensive case management as a clinician, and how to support families, our patients who are vulnerable senior citizens, and my coworkers. Thank you.